What's going on, all of my healthcare brothers and sisters? I hope that you are having a wonderful day. We are continuing on with our NCLEX and nursing school exams like a boss series discussing arterial blood gases, and we're going to be using the Rome mnemonic when it comes to our ABG interpretation. Let's get our nurse on. So you might be like, Nurse Cheung, what is Rome and what does that have to do with arterial blood gases? Well, when we use the word Rome means respiratory opposite, metabolic equal. That's what helps us determine what's happening with our arterial blood gases. So let's take a look at what our normals are, and let's look at a few examples of how Rome can help us determine what's happening with our ABGs. So what are our normal values? If you haven't watched my ABG interpretation video from before, I highly recommend that you go and watch that now because it really goes over the different buffer systems and how we determine what our ABGs are based on our normal values. So make sure that you go ahead and check that out. But for now, our pH normal value is 7.35 to 7.45. Our PaCO2 is 35 to 45. Our HCO3, which is our bicarb, is 21 to 28, and our PaO2 is 80 to 100. So when we're looking at the respiratory component of our arterial blood gases, we know that the specific piece of our PaCO2 HCO3 buffer system is the PaCO2. That is the carbon dioxide that influences the respiratory component of arterial blood gases. So we know that if our PaCO2 is high, we've got more acids, it's going to make us more acidic. Whereas if our PaCO2 is low, we're losing more acids, maybe we're hyperventilating and we're exhaling them out more than we should, it's going to make us more alkalotic. We're going to be more alkaline. And something we touched upon before is that these changes happen very quickly. We're talking 10 to 30 minute changes. We can influence the respiratory system very, very quickly. Just like with our respiratory component, we have a metabolic component, and that is going to be our HCO3, our bicarb. When that's imbalanced, we're going to start seeing shifts when it comes to the metabolic component. So if we have a lot of base, if we've got an excessive amount of base, we're going to be in a more alkalotic state. Whereas if we're losing a whole bunch of base, meaning we're going to have more acids in our system versus bases, we're going to be in a more acidic state inside our body. But what makes this so much more difficult is changes occur extremely slowly. We're not talking about with our carbon dioxide where we're able to exhale all of that acid. We can't do that with this particular buffer system. When it comes to the metabolic component, the kidneys are only able to work as quickly as they can. So we're looking at maybe days to weeks for changes when it comes to metabolic issues. We have to get the acid, we have to get the base inside of the tubules of our kidneys. They've got to combine to whatever buffer system or sodium component they need to combine to, and they get excreted throughout the urine. That process takes time, especially depending on how severe our metabolic imbalance is inside of our body. So like we talked about before, when it comes to acidosis, we know that our pH is going to decrease. The more acid we have in our system, the further decreasing of our pH will be. So we're going to have a pH of less than 7.35. Our acid component, which is our carbon dioxide, or PaCO2, is going to increase. The more acids we have, the more increase there will be with our PaCO2. It's going to be greater than 45. And when it comes to our base, again, that's our alkaline component, that's our metabolic component. Our HCO3 is going to decrease. It's going to be less than 21. When it comes to our alkalosis state, we're going to have a pH that's going to be greater. Remember, we're losing acids, so it's going to go up. Our pH is going to be greater than 7.45. Our PaCO2 is going to decrease because, again, that is an acid. The more acids we lose, the more alkalotic we become. It's going to be greater than 35, and our base is going to increase. That's the alkalotic portion of our blood, right? Our HCO3, our bicarbonate, is going to be high. It's going to be greater than 28. So how do we use this Rome mnemonic? Well, again, we talked about it before, respiratory opposite, metabolic equal. What does that mean? Well, if our pH is low and our PaCO2 is high, it's an opposite value, right? So if our pH is low in acidosis, it's less than 7.35, and it's high in PaCO2 greater than 45, that means respiratory opposite. So we know that it is a respiratory component happening within our arterial blood gas. Whereas metabolic equal, our pH is going to be the same. So they're either both going to be high, our pH and our bicarb or HCO3 will be high, or our pH and our HCO3 is going to be low, metabolic equal. So if those two values are equal and their arrows are pointing in the same direction, we know that is a metabolic component. Whereas with respiratory, if our values are opposite of one another, we know that it is a respiratory component. So let's do a couple examples to see if we can figure out how to use the Roman mnemonic, and if it helps you make ABGs a little bit easier. So let's take a look at our first example. We have a pH of 7.21, a PaCO2 of 37, and an HCO3 of 18. So we begin always by looking at our pH, where our normal is 7.35 to 7.45. So we know that this is less than 7.35. So this is going to be more of a acidosis, right? Next, we move on to our various components. So we begin by looking at our respiratory component because we know that happens quickly. Our normal is 35 to 45. This falls within that normal limit, so we know that our PaCO2 is going to be neutral. Moving on to our bicarb, our metabolic component, our HCO3 is 18. Normal is between 21 to 28. We know that this is less than 21. This is going to be an acid state. So again, using our own respiratory opposite, metabolic equal, does our pH and our PaCO2, our respiratory component, are they opposite of each other? Well, no, they're not, right? Our pH is low, but our PaCO2 is neutral. So we know that this is not a respiratory component. So we move on to our bicarb. Is this a metabolic component? So metabolic equal, respiratory opposite, metabolic equal. Does our arrows point in the same direction as our pH and our metabolic component? And they do. They're both pointing down, that meaning that they're both acidic. So we know that this is a metabolic acidosis. So metabolic equal, they're both pointing down, they're both acidic, so we know that it is a metabolic acidosis. So let's take a look at another example. So we have a pH of 7.28, a PaCO2 of 60, and an HCO3 of 24. As we always do, we begin with our pH. Is it high or is it low or is it even neutral? Our pH is 7.28, normal is 7.35 to 7.45, so we know that this is low. So this is going to be an acid, right? As we see over here, it falls within that acidic area. Next, we look at our PaCO2. Normal PaCO2 is 35 to 45. Our PaCO2 is 60. It's greater than 45, right? So we know that we have an acid. And lastly, we look at our HCO3, and it's 24. We know that our normal bicarb is between 21 to 28, so this is actually a neutral value. So again, we begin respiratory opposite, metabolic equal. We look at our pH and we compare it to the respiratory component, our PaCO2. Do the values, do the arrows point in separate directions? They do, right? So we know that this is a respiratory particular component of our arterial blood gas. So we have an acid, we know that this is an acid, and we know that it is respiratory because based on our Roman mnemonic is telling us that it is a respiratory issue. So in this particular case, we have a respiratory acidosis. I hope that this video was helpful in helping pass your arterial blood gas nursing school exams as well as your NCLEX like a boss. If you haven't done so already, make sure that you subscribe here to my YouTube and hit that notification bell so that way you're informed every time I post a new video. You can also follow me on my social media. I am on Facebook and Instagram, and make sure that you check out my website at www.nursecheung.com. There I'm going to have NCLEX style questions, resources, handouts, everything you need to pass those exams like a boss. But until next time, I hope that you're having a wonderful day, and I will see you all again soon. Bye.